This is our group project on the false claims lawsuit against eClinicalWorks. In this video, we will be talking about the background of the case, the key players, the lawsuit and consequences, and the ethical, social, professional, and legal issues. On May 1st, 2015, in the District of Vermont, Brendan Delaney filed a lawsuit under the whistleblower provisions of the False Claims Act. On May 31st, 2017, eClinicalWorks agreed to a settlement of $155 million. Delaney and the government alleged that eClinicalWorks had lied in order to get its electronic health record certification and had paid illegal kickbacks to companies to advertise their product. The lawsuit was taken over by the government and ended with eClinicalWorks agreeing to pay the fine and entering into a corporate integrity agreement with the United States Department of Health and Human Services. On February 17, 2009, the government enacted a policy in which they would pay healthcare providers incentives to demonstrate meaningful use of EHR technology. However, this meaningful use was only valid if the EHR software was approved by a certifying entity that had previously been approved. The certification test is not really as rigorous as one would think it would be. A company looking to get their EHR system certified submits to the certifying entity what qualifications for certification their product should be able to meet from a list. The software is then tested only on the criteria that the company claims their product will be able to perform at. The certification body uses standard test scripts that are available to vendors before they are tested. A press release from the government states that certification testing does not confirm that each criteria and standard is satisfied in full and under every conceivable scenario. Rather, testing takes a snapshot of a product's capabilities by ensuring it can pass certain pre-disclosed test cases. These are the 15 core requirements that the company must fulfill in order to get the incentive payments. There are also 10 menu objectives. The company must satisfy at least one of the first 2 public health requirements shown in green. They must complete an additional 4 out of the remaining 8 on the list for a total of 5 menu objectives. In 2010, Brendan Delaney, a former British cop, started working for the New York City Department of Health and Mental Hygiene. He was in charge of converting the paper records for the patients at Rikers Island into electronic ones. He noticed a lot of issues and deficiencies with the software. Some patients were listed in the same record. Some medications were misprescribed. Some lab orders were placed but were never processed. Delaney feared that these issues would lead to the death of a patient, and he decided to blow the whistle. When he first brought the issue up to his managers, none of them seemed to want to do anything about it. Even as he went higher up, no one seemed to want to take any notice. Eventually, he gathered his evidence and took his case to the law firm Phillips & Cohen. They made their case in the District of Vermont. The government ended up joining the lawsuit and added their own charges. Randy Stern, a Vermont innkeeper, was trying to figure out how his wife died. His wife, Annette, had gone to the hospital complaining about crushing headaches. The doctor had requested a MRI through eClinicalWorks system, but the test never came. A patient was found unconscious in Rikers Island because he was over-medicated due to the problematic system.
eClinicalWorks. eClinicalWorks was founded in 1999. Its headquarters is in Massachusetts. eClinicalWorks was founded by Girish Navani, the Chief Executive Officer, Rajesh Dharampuriya, the Chief Medical Officer, and Mahesh Navani, the Chief Operating Officer. According to its website, ECW has more than 850,000 clients across the United States, and their software is used by over 100,000 physicians. They are the largest internet-based electronic medical record company in the U.S. They make over $333 million in revenue each year. Colette Mazzi. After getting no reaction from his higher-ups, Brendan Delaney decided to search up whistleblower on Google, which resulted in him finding Colette Mazzi, a lawyer from Phillips & Cohen firm. During his meeting with her, Brendan reached across the table and told her that someone was going to die if nothing was done. Brendan showed Mazzi all of his acquired evidence against eClinicalWorks. With her help, Delaney filed the claim against eClinicalWorks to the Department of Justice. 2 years later, the claim was rejected. The case. Delaney's original case alleged that the deficiencies with eClinicalWorks rendered it ineligible for incentive payments related to meaningful use. The government joined the lawsuit with the complaint that ECW lied about the capabilities of their products to meet government EHR standards. They took advantage of the testing script and they found ways to work around it so that their product would appear to work even though it actually didn't. They failed to adequately test their product before it was released. There were numerous bugs that existed in their software even as it was released to the customers. They ignored critical and urgent problems and bugs for months or even years at the time. When a bug was found and reported, they would claim that they would get around to fixing it, but they never actually followed through. They failed to satisfy data portability requirements. For example, eClinicalWorks did not have a capability to do batch export, which would allow the users to export patient data in one action. They failed to audit log requirements. Audit logs keep a record of the activity and chronology of patient care. They failed to reliably record diagnostic imaging orders. In certain scenarios, when an order was placed, it would only show up in one specific section of the record, and not in a place where the doctor could see it if it needed to be followed up on. They failed to reliably perform drug interaction checks. If a doctor went to customize the prescription for the patient, it would cause the drug interaction check not to initiate. They paid kickbacks totaling at least $392,000 to influence customers to recommend eClinicalWorks products. What were the consequences of their actions? The lawsuit was settled with eClinicalWorks and its executives by paying $155 million and entering into a corporate integrity agreement with the HHS, the Office of Inspector General, OIG. The founders, Girish Navani, Rajesh Dharampuria, and Mahesh Navani, were responsible for paying $154.92 million, while the developer, Jagan Vaithalingam, has to pay $50,000, and the project managers, Brian Sakira and Robert Lines, were responsible for $15,000 each. Out of the $155 million that eClinicalWorks paid, Delaney received $30 million because he was the whistleblower. The corporate integrity agreement required them to fix their software and have another approved entity access their system, and they had to regularly report to the OIG. They were also required to compensate their clients through one of two methods. The first option was that they had to provide all their clients with the means to move their data to a different EHR company free of charge. For the clients who chose to stay with them, they were required to provide a free upgrade to their latest software that actually works. Groundbreaking case. This case was the first time that the government has held an electronic health record vendor accountable for failing to meet federal standards designed to ensure patient safety and quality patient care. Additionally, the settlement is also the first time an electronic health record vendor is being held accountable for the truthfulness and accuracy of representations made when seeking government certifications of its electronic health record system, and the first time that the government applied the federal anti-kickback statute law to the promotion and sale of EHR.
The legal issue for this case is that eClinicalWorks lied about the capabilities of their software when they were presenting it for examination. They knowingly took advantage of the test script so that they could make it appear like their product was working, even when it wasn't, and they didn't let their customers know about the deficiencies with their product. The test script for RX Norm Vocab tested the software's ability to read the codes, but instead of coding their products to be able to access the complete database, they hard-coded the 16 drugs they knew it would be tested on. It also didn't transmit the RX norm codes for e-prescription like it needed to. They weren't accurate when they were sending out the prescription codes. They knew this and ignored the problem. They didn't test their code before releasing it. They just waited for their clients to report the bugs, but they would often ignore the bugs or problems even if they were labeled urgent. They paid money to clients with significant influence who would advertise their product. In one case, it seems that the deficiencies with eClinicalWorks software led to the death of a woman suffering from a brain aneurysm. Upon investigation, it was found that the doctor had suspected an aneurysm and ordered a test that would have detected it, but the order for the test never registered in the program. Unfortunately, it was never left to a court to decide whether eClinicalWorks was responsible for this, as the case was dropped shortly after the settlement. Another issue exists in the fact that the testing wasn't thorough enough to detect the fact that eClinicalWorks did not have a functioning software. The test was only supposed to get a snapshot of how the product worked, but even with all of the bugs existing in eClinicalWorks software, the test wasn't able to detect any problems. Many aspects of the testing process allowed eClinicalWorks to take advantage of it. The fact that they had the opportunity to choose what they would be tested on, and the fact that they knew how they would be tested both contributed to eClinicalWorks tricking the test. On top of that, there were checkup tests that were conducted after eClinicalWorks received its certification, but those tests were the exact same ones that eClinicalWorks had been tested on the first time, and so they passed them still. Along with the lax testing, the climate for the transition to electronic health records was very rushed. When the government announced that it would be giving incentives to offices that used electronic health records, there was a rush for companies to output a product as soon as possible in order to not lose out on customers. This hurried attitude explains why eClinicalWorks was in such a hurry to put out a product, even if it wasn't functional. Part of the corporate integrity agreement involved eClinicalWorks providing their clients with either new working software or with the ability to switch to another electronic health records company free of charge. eClinicalWorks claimed to be following the agreement they settled with, but certain companies were saying that they were essentially holding their information hostage, so they don't have the ability to switch to a different electronic health records company. While eClinicalWorks provided a free option for transporting the data, it wasn't encrypted. But if the customers wanted any higher quality transfer, they had to pay $500 or more. The transfer would also take roughly 4 to 6 weeks, so that's 4 to 6 weeks where the doctor would be without the ability to use the records. On top of that, eClinicalWorks still charges a full price for using their product until the data had been completely transferred over. Most other companies have a glide-off option that allows doctors to transfer the records and still use them while they're being transferred and pay a reduced fee to access them. Some offices are hoping that the government steps back in to force eClinicalWorks to better comply with the corporate integrity agreement that they agreed to in the first place. The ethical issue with this study is that Brendan's managers didn't seem to care about the issues with the software, possibly because they were dealing with convicts. Delaney said in an interview, "I was profoundly saddened and disappointed by the indifference of senior health department officials and investigators for New York City when I provided detailed information about serious flaws in the electronic health record software that could endanger patients. In all of the sources we found on this case, they only mentioned Delaney's managers in passing, although it seems pretty important that they would want to help eClinicalWorks cover up their faulty product." Following the news of the settlement, a majority of customers were found to have a more negative view of eClinicalWorks, and in some cases, electronic health record companies in general. Despite this sting on their reputation, eClinicalWorks has continued to exist as a company and has even procured new customers. They've continued to make advancements with their software and are still advertising their product. So it seems that the settlement has had a small impact on the company's ability to grow. Going forward, eClinicalWorks continues to face legal issues. There was a $1 billion lawsuit when a cancer patient died due to inaccurate medical records and being unable to first determine the signs of cancer. We believe that eClinicalWorks definitely deserved the punishment they got, if not worse. More investigation should have been made into the higher-ups at Rikers and the health department who didn't want to look into the issues with the software. The government should have more closely monitored eClinicalWorks to make sure they were upholding the corporate integrity agreement, and should keep monitoring them now to make sure that they aren't taking shortcuts with their product.